healthcare around the world and you look at what people talk about, the three-pronged stool of maintaining a healthcare system, and there's three aspects of that only two of which you can have, and those three aspects are affordability, access, and quality. As an economist, which one of you are going to sacrifice in order to be able to sustain our system?
Well, let me describe more the framework that I lay out as a possibility, which I don't think compromises either three of those. All right. First, I think we way overpromised on health care. There's no way we can deliver on everything that's been promised. I think government has a tendency to promise way more than it can deliver and to subsidize way more people that ought to be subsidized. All right? And so what I propose is to say the following as a point of consideration. What are broad-based societal needs that are legitimate, that in a country like ourselves we ought to meet, versus unlimited individual wants, because humans want as much as they can get, especially if somebody else will pay for it. All right? And that, I would respectfully suggest, is universal, preventative, wellness, and catastrophic protection, guaranteed insurability, broad-based pool, with options to get more if you want, but you're going to have an economic stake. You're going to have to make some judgments on that. We have to change. We have to have a budget on how much we spend on health care. We have to start paying for outcomes rather than activities. We need to change our tax incentives and preferences that we have there, which are really perverse, if you will. We need to recognize that those that are poor and the indigent and the military, we're going to do, disabled veterans, we're going to do more for. But that's a special segment of the population. We need to treat them accordingly. But, right now, let me give you an example of Medicare. Medicare is 3 programs. Part A, mandatory, funded with a payroll tax. Not adequately, but funded with a payroll tax. B and D, voluntary. You don't have to sign up for them. Medicare supplemental medical outpatient physicians. D, prescription drugs. You don't have to sign up for them. But 95% of people do. Why? Because they're 75% subsidized by the taxpayers, by your kids and your grandkids. That's who's subsidizing, all right? It's one thing to provide universal opportunity and subsidy for people that are near poor. It makes no sense to provide universal subsidy for people that are well off. And so that's an example of where first we have to define what we're promising, then we have to define who should be subsidized and to what extent. And that's just one small example. Yes?
I'd like to know how we can go about shrinking government, meaning take away the Department of Education and let the states take care of their own, cut back on the farm.
Yeah.
All ag department, all of the departments can be cut way back. Plus the fact that the humanity, for whatever reason, does not take care of their own health. We had to take care of our own health.
Yeah.
You had an insurance policy that took care of the big, and the rest of it you paid for.
Yeah, the catastrophic.
Health care is big business, period.
Okay. Give me the one big thing you want me to address. Because I could go on for all right. First, believe it or not, the federal government's been in existence since 1789, and it still has no plan. No plan. There's no strategic, forward-looking, threat, risk, opportunity-based, outcome-oriented, resource-constrained plan. So what does government do? It sees an opportunity, it sees a want, sometimes a need, sometimes a want, and it wants to create something, it wants to spend more money, it wants to provide more subsidies, it wants to issue more regulations without asking itself, is this a proper role for the federal government? Is it a proper role for government? And so I think one of the things we have to do is we really have to step back. We are so far out of shape that we're going to have to fundamentally reassess what should government do, what level of government should do it. And I think one of the things that we need to put on the table is something that Ronald Reagan put on the table. And that is, maybe we need to have a discussion with the states about redistributing responsibilities and authorities for who's responsible for what. You know, the federal government only provides about 7% of funding for education. You're not going to make a big difference with 7%. Oh, it's the furthest removed from the people. Maybe we ought to be relooking at what government does and who does it, and to reprioritize. So therefore, we shrink government. We get people more focused. We get at the right level of government. We get them focused on the right things, closer to the people, and generating results. So yeah, I think we need to do that, and that's something that's addressed. That's something that's addressed in one of the chapters of my book called Transforming Government. And one of the things it does, it asks about, I can't remember exactly how many, 12 to 15 questions that ought to be asked about every major federal government program, policy, subsidy that's never been asked. Never been asked. And by the way, it needs to be done at all levels of government. The federal is the worst shape, but it needs to be done.
I'd like to add something here. When I first came into office, I got about 25,000 Nebraskans contacting me a year. Now that number is probably north of 75,000. Same amount of staff, they're actually less. Same amount of resources, basically. What that says to me is that there is a new intensity of engagement, and really at its heart, it's around that philosophical question. Who are we as a people? Where are we going as a nation? And what is the proper roles of government for outcome-based stewardship of society toward those goals? And I think, if I can summarize it most succinctly, all the various debates that we're having really come down to those core types of questions. So in your specific question, you're begging a much broader, really transcendent type of discussion. But
Can I give a concrete example? When I was Comptroller General of the United States and head of the GAO had been in existence since 1921. They had no plan. I came in 1998. We did what I just said. At the end of 9.5 years, we were 9% smaller, 50% more productive, and had over double the outcome-based results. What we did is scalable and transferable. But it took committed, effective, persistent leadership, because it goes from patience to persistence to perseverance to pain before you prevail.
we also need a people who's willing to be led in this direction. And that's the other issue here. Let me kind of zigzag around. We're going to have to wrap up and let everybody get back to work. We'll go in the middle. Yes, sir. In the blue.
Yes, you mentioned earlier 2003 and the 3 bad things that happened. Can you say anything about fighting wars as a discretionary expense and what this has to do with the plans that you have?
Well, first, I don't think we're following the Constitution in a lot of ways. And this is one of the primary things. Congress is supposed to declare a war. Congress, by the way, is also supposed to have a budget. The only thing that Congress is supposed to do every year on the Constitution is create a budget. We haven't had one in the last 2 years.
The House.
Yeah.
The Senate.
Well, the Congress is the Senate, but you're in the House. But that's okay. No, my point is we're not following the Constitution. All right. B, my son fought in Iraq, and I'm proud of him. We never should have been in Iraq. We never should have been. If you're going to invade a sovereign nation for whatever reason, you declare war. And you also call the American people to make contributions, and you don't charge it to the credit card. And you clearly define what your objectives are, and then when they are achieved, you're out of there. All right? It's just a small example with lots of money and lots of lives and lots of international consequences of how we've lost our way. And we've got to come back.